One of the most reassuring things that you can have during your pregnancy, and one of the most connecting things you can have during your pregnancy, is feeling your baby move. And so we're going to go through a bunch of questions. We have a viewer and a subscriber that is going to be asking us some questions about fetal movement, kick counts, and all of the above throughout your pregnancy. So let's get to it. It matters where you get your information. My name's Eric Schmidt. I'm a board-certified OBGYN, and let's talk about fetal movements, kick counts, and all of that in this video. Always remember, this is educational information. You may have very specific recommendations given your own pregnancy. Please listen to your own provider regarding your recommendations.
Hi, my name's Rebecca. I have questions about fetal movement and kick counts during pregnancy. I've heard a lot of different opinions out there about fetal movement and kick counts during pregnancy. I was wondering if you could tell me, when would someone start to feel baby move?
Thank you for the question, Rebecca. Well, there can be several factors that might influence when somebody starts to feel their baby move for the first time. And of course, if you might notice on your early ultrasounds, the baby's often very active and moving. But when mom can actually feel that varies by, is it their first pregnancy or not? So if this is your first pregnancy and you're not exactly feeling your baby move, maybe you heard somebody say, oh, I felt my baby move at 16 weeks. Don't let that scare you for 1 second, because often first-time moms may not feel their baby move until 20 weeks, maybe even 24 weeks. To contrast that, like I said, people who it's their second, third, fourth pregnancy, they may feel the movement potentially as early as the early second trimester. Where the placenta is located also is a big factor in this, because if that placenta is located, we call it anteriorly, or more towards the belly side versus the back side, that can cushion a lot of the movements from the body's ability to feel it, because a lot of that sensation of feeling we get from our own abdominal wall and skin and the nerves connected there. So if there's that additional padding, you might not feel your baby move as much, especially early on in the pregnancy.
I've also heard that babies' movements can change throughout the pregnancy. Is that true? What would you expect to feel with that?
That's exactly right. So the perception of baby's movements is felt differently throughout the pregnancy. Now, in the second trimester, often it can be inconsistent, especially early on. This is a point in time where I'm not recommending patients to do things like kick counts, but we'll get into that more in a little bit here. And some studies have showed that while ultrasound is being done, that baby, approximately 50% of the movements, moms aren't feeling. And so hopefully this can reassure you that, again, if you have a normal ultrasound, you don't have to worry if the movement is a little inconsistent, especially in the second trimester. Moms also might notice that the movements might change throughout the day. Often moms are feeling the movements more at night, and it might make it hard to sleep because of the movements. And this could be through a number of factors, but most likely often when we are busier during the day, we might not be paying attention to the movements, and so we might be missing a lot of them. But baby is, again, actually doing just fine, moving a lot. It's just the mind and body is occupied by other things more often during the day. Okay, and going into the third trimester, again, most often perceived movement is the most at the 28 to 32 weeks, but then baby's starting to grow bigger, baby's starting to settle head down, hopefully, and isn't moving their position drastically too much, especially after 36 weeks pregnant. Additionally, baby is not only getting bigger, but losing a little bit of amniotic fluid. Again, there isn't as much room for baby to make those big movements, but someone should still be perceiving some movement. And I do, again, just let patients know that going into the last couple months of pregnancy, your own baby's movements might vary a little bit. And as long as you keep checking in with us, this could be potentially deemed as a new normal for that individual.
I've also heard a lot of different opinions about when to start counting kicks during your pregnancy. Is there a specific point?
When to start kick counts? Oh, it's a good question, and there's a lot of variance out there with these recommendations. In a low-risk pregnancy with no significant risk factors, generally I would say kind of early mid third trimester is when, if you're not feeling consistent movement, to do the kick counts. Sometimes I caution patients not to start their kick counts too early, let's say 24 weeks in the pregnancy, because the movements are often inconsistent. You're not going to feel baby move on a regular basis as much as if you were in your third trimester. And so if you're sitting there every day trying to feel the movements of your baby and count your kick counts, there's going to be a lot of times where you don't meet that 5 or 10 kicks in 1 or 2 hours. And so it's going to lead to potentially a lot of anxiety, a lot of visits to the emergency room, when in a low-risk pregnancy probably isn't needed. More importantly, what I recommend is be familiar with your baby. Kind of get an idea what their movements are like, and try not to compare yourself to others. And that's going to be a main point in a lot of my talks is people give their own unsolicited advice. You don't always have to follow it. You don't always have to compare their pregnancy to your pregnancy, and you probably shouldn't. Please listen to your provider and know the risks of your own pregnancy so you can help do the best thing for you.
How often are you counting kicks? Is it once through the day? Is it multiple times throughout the day?
The question is, how often do you do it? Well, again, not great evidence to support you should do this at least once a day, or you should do this twice a day, but you might hear some people say that. For me, it's more of if you're feeling something out of the normal or not feeling something out of the normal, then you would do your kick counts. And the way that this is done is you lay down, rest. Generally, you would lay down on one of your sides to make sure not to obstruct any blood flow through your vena cava when laying down, and babies could potentially be compressing that. So you lay down, you rest, maybe drink a little bit of cold water, maybe have a snack, and you're really paying attention to your baby's movements. Maybe even putting your hands on your belly to further help perceive the movements. But my recommendation is in a lower risk pregnancy, generally, I'm hoping that you get at least 10 movements, not hiccups, but just 10 little movements. They don't have to be massive whole rolls, just little movements in about 2 hours. And you might hear some people recommend 5 movements in 1 hour. Or you might hear people say, well, you sit there and you count the movements and you record how long it takes that. If you get those 10 movements, let's say within 10 seconds or 2 minutes or 3 minutes, you can kind of stop there, feel reassured your baby's doing well. You don't have to lay down and rest for that whole hour or two. But usually my recommendation and how I would diagnose decreased fetal movement is if you're not feeling at least those 10 little movements in a 2-hour period, that's usually when I'm recommending my patients to come in and get evaluated right away.
What do I do if I don't reach that number of kicks?
Okay, so let's say we're going down the road of we're not getting the kick counts, you're going to your provider. Well, how can we reassure ourselves that baby's doing well? There's a couple ways. One way is when we listen to the heartbeat for 20 to 30 minutes. That's called a non-stress test. This is looking at baby's heart rhythm. We look for a few things on this test to reassure ourselves, and we can do additional tests on top of this. One would be an ultrasound where we can check baby's fluid, baby's movements, baby's tone, and all of these things, components go into what's called a BPP along with the breathing movements. I didn't mention that. And the BPP along with NST is what we call antenatal fetal surveillance, or that's how we tell and reassure ourselves that baby's doing good and not getting stressed out by something.
Is there ever a concern that baby is moving too much?
And thank you for those last couple of questions, Rebecca. Is too much movement a concern? No, not really. Especially if you're around that week of 28 to 32, you're feeling a lot of movements, especially at night. And so generally, too much movement is not associated with anything bad. Same goes for hiccups. Hiccups generally are not a negative finding at all. Sometimes hiccups, or sometimes it could be breathing movements, babies using their diaphragm, expanding those lungs with amniotic fluid that they're taking in. And so sometimes this can also be perceived as hiccups, and breathing's a reassuring sign. Like I said, it's one of the things we really look for on the BPP test that we do. All right, thank you everyone for listening in, and thank you, Rebecca, for all of your great questions. Everyone have a good day.